I'm Dr. Michelle Henning. I work at Coastal Pediatrics as a pediatrician, and I'm here to talk to you today about safe sleep guidelines for your baby. Bringing a newborn home from the hospital is a very exciting time, and we encourage you to cuddle and hold your baby and bond with your baby, but we want to make sure that you're aware of the sleep guidelines to make sure that your baby is in the safest position for sleep. When your baby is asleep, we want to make sure that you put your baby down on his or her back in the appropriate environment, and that should be in a crib or a bassinet. They should be alone. It's never safe for you to put your baby to sleep on a couch or a chair or in your own bed. The mattress is firm in a crib or in a bassinet, and you can put a tightly fit sheet on that. You want to make sure that there's nothing else in the crib. It should be bare. No bumper pads, no pillows, blankets, or any stuffed animals, as these things can obstruct their breathing and can also contribute to overheating. Although we never want you to share a bed with your baby, we do want you to share your room with your baby, because studies have shown us that the incidence of SIDS, sudden infant death syndrome, is decreased by 1/2 if parents have the baby sleeping in the same room. We encourage you to do that for up to 1 year and at least to 6 months if you're able to do that. Other things that can help decrease the risk of SIDS is breastfeeding. We have found over studies that that is a protective factor, and we would also encourage you to avoid exposure to secondhand smoke, which increases the risk of SIDS. Pacifiers are okay, but you never want to put a pacifier in a baby's mouth who is already sleeping. You never want to be forceful with that, and you never want to have any strings attached to the pacifier, as this can contribute to accidental strangulation. To avoid overheating, you want to make sure that the room is set at a temperature that is comfortable for an adult who's lightly clothed. Unfortunately, there are approximately 3,500 infant deaths each year related to sleep, and this includes sudden infant death syndrome, accidental suffocation, and accidental strangulation. So if you have any questions or concerns related to your child, we always ask you to talk to your pediatrician.